what I want to do, I want to do this a little different. So come on over here with me into that chair. Now, everybody has different chairs at home, but basically, I'm looking for 2 chairs. Usually they're going to be dining room chairs that are about the same. What I want to do is if you can pick up that foot, so the surgical side knee, what I'm going to do is I'm going to set this in nice and close, just like that. So the way we've got it set up is the chairs are offset just a little bit so your non-surgical foot can be on the floor. The surgical foot is there with the toe kind of pulled back. Now, do you feel any pull or stretch behind the knee itself?
Not with that.
Okay, perfect. Do you feel any stretch through the calf or anything? Okay, so what I want you to think about is just what you did. Think about pulling the toes back toward you and then relax. Do that 2 or 3 times. Do you notice what happens at the knee? See how the knee wants to curl up and then back down? Mm-hmm. What I want you to think about is think about pushing the knee down and straight as you're pulling the toes back. Now you feel that difference? What did you feel different?
Right to here.
Yeah. So the muscles are going to work totally different. So we're going to spend about 2 minutes. We'll watch the clock. The most important thing is you want to think about using the muscles in the knee to drive the back of the knee down as you're flexing the ankle back. Because the normal motion is the ankle flexes. There you go. That's totally different than what you were just doing 10 seconds ago. I can see the quadricep get tight. I can see the knee go a little bit straight. Muscles are working differently. Let's get about 5 more of those, and then we'll go to the next exercise.